Hi everyone, I'm Russ Smith from Rutgers University.
And I'm Carlos Pratt, and we are from the Department of Psychiatric Rehabilitation and Counseling Professions.
We're very happy to join you on World Mental Health Day. We thank you very much for this invitation. And we'd like to tell you a little bit about our work at KAH over the last 8 years or so. We were approached about 8 or 9 years ago by two colleagues from the US that actually originally are from Pakistan. One of those persons is Shaheen Ahmed, and she actually started a board interested in mental health services in Pakistan. The other person, Shafiq, is the person that was affiliated for a long time with Fountain House in New York City, a very famous program that a lot of you probably know about. And so Carlos and I became part of that board. And in 2008, we started planning for a visit to KAH to pursue the idea of a collaboration between us. I spent about 8 days there and spent time talking with participants, staff, the leadership, the board, doing some seminars. And what came out of that, because of the enthusiasm of the leadership and all the people there, was a 15-day Skype long-distance training that we commenced about 2 months after that. And Carlos is going to tell you what the main outcome was of that training we did.
At the end of the training cycle, a group of KEH staff members reviewed evidence-based practices to find one that they thought would work well at KEH. They settled on illness management and recovery, and they were right. Illness management and recovery is a group of evidence-based practices designed to help people manage their illness and eventually recover from their illness. The process starts with teaching the patients about the concept of recovery and the idea that recovery is possible, and then helping them to set an overall recovery goal. That recovery goal drives the whole process forward. Once they've set a recovery goal, new modules in IMR teach them about their mental illness, about the medications and what they're for, about how to cope with the different symptoms that they may be having, how to set up support networks, and other kinds of things that are helpful to people that need to manage their illness and eventually recover from it.
So the result of that, the IMR sessions, we had some realizations about that. One was that it wasn't just the participants that gained from that and had some, were inspired by certain aspects of the group. And that was that the staff, after it was over, where we got through the 9 modules, came to us and said, we feel like we've made connections, we've helped people achieve and establish and achieve recovery goals, and now we're not doing that anymore, and we feel like we want to continue with working with people. So we came up with an idea to establish a case management system. It's basically a pilot project, starting with basically the 30 or so people that were in the IMR groups, and we basically assigned people to one of the staff to do advocacy, continued support counseling, real individual service planning. And we found that to be a really helpful thing for the participants, and really gave the staff a sense of connection with the people they were working with. The other thing we established on that visit was another evidence-based practice called family psychoeducation. Basically, having family groups that get some education and information they need about mental illness, and also establishing a support group where they can meet with other family members and talk about their experience of supporting their family member. So at this point we've had 4 visits to KAH. We've also provided 4 trainings, including a train the trainer event where we basically were teaching people at the program, staff, how to do the training. So Carlos is going to talk now about future plans that came out of that the last visit, by the way, was in June of this year. And so Carlos is going to tell you about some plans that developed from that.
Yeah, Professor Smith and I and Dr. Cosme have been very excited about the progress that the staff has made at KEH. And these are some of our future plans. Of course, one thing we want to do is we want to continue training and consultation like as it's needed. And we think every once in a while with staff turnover, that's going to be needed. We're planning to do a study of IMR, the outcomes we get of IMR at KEH, which is very exciting. And that process is going forward. Nasir and some other people are working on that with us, and that should start up very soon. We'd also like to develop an abbreviated IMR process. What we found is that a lot of people don't spend enough time at KEH to go through the entire IMR process. So our question is, which are the IMR modules that are most important for them to have right away? So that's another thing we're going to study. And we also are interested, as Professor Smith just said, in what other evidence-based practices might really be effective and really be helpful with KEH completing its mission there.
Very good. We hope we didn't go over our time allotment, but we thank you so much for inviting us again, and look forward to our continued collaboration, and looking forward to coming back to Karachi soon. Thank you
Very much so. Thank you.
Bye-bye.
Bye-bye.
Warm regards.